Mr. President.
Senator from Rhode Island.
Mr. President, I ask unanimous consent to speak for up to 15 minutes as if in morning business.
Without objection.
Thank you, Mr. President. I'm back for my weekly Time to Wake Up speech, which, given the theme of the week here in Washington, is going to focus on the health consequences of what is going on in climate change. And it's timely to do so because just recently, the National Weather Service issued an excessive heat warning for the southwestern United States. In California, San Diego County set a record at, 124 degrees. 124 degrees. As a result of this heat, the Weather Service warned of, and I'll quote them here, a major increase in the potential for heat-related illness and even death. Out in Phoenix, Arizona, it got up to around 120 degrees. It got so hot that flights had to be grounded at the Phoenix airport because the hot air was too thin for the jet engines to get enough bite on the air for the planes to fly safely. The emergency rooms saw patients coming in with burns caused by walking barefoot on hot pavement or touching their cars that had gotten so hot in the sun that they were burned. And there were several heat-related deaths reported in the Las Vegas area and in California. This heat wave problem is not going away. Heat waves like the one we are seeing in the Southwest are becoming much more frequent, said Robert E. Kopp, director of the Coastal Climate Risk and Resilience Initiative at Rutgers University. He went on to say, looking forward, we expect the amount of extreme heat on the planet to continue increasing even more, with obvious health effects. It has gotten deadly serious in many places. In the 2003 European heat wave, there were more than 30,000 deaths across the continent, and the three-day 1995 Chicago heat wave killed more than 700 people. So we need to pay attention. As Mr. Kopp concluded, this calls for a major rethink of the systems that we rely upon. This is not normal any longer. This week also saw the publication in the Providence Business News of an article by Nitin Damle called Climate Change's Dire Health Consequences. Nitin Damle is a physician in Rhode Island. He is a leader of our medical profession in Rhode Island, and just recently was the president nationwide of the American College of Physicians. In the Providence Business News, he writes, the medical community is witness to the health effects of climate change now and not in some distant future. There are 5 categories of health effects that will affect not thousands, but millions of people in America and around the world. First, as we just talked about, we saw in Arizona and in Southern California, he goes to say, an increase in global temperature and frequency of heat waves will expose people to a risk of heat exhaustion, dehydration, headaches, weakness, nausea, and vomiting, and or heat stroke, high fever, stroke, confusion, and coma. The most vulnerable will include the elderly with multiple heart, lung, and kidney conditions, multiple medications, and a poor ability to regulate their body temperature. But Dr. Damle goes on to say that children will also be at risk due to their inability to thermoregulate, as will laborers who work outdoors and the homeless. He goes on to report that history tells us there have been 7,400 annual deaths between 1999 and 2010 in the United States, 15,000 deaths in France in 2009, 70,000 deaths in Europe in 2003, and 15,000 deaths in Russia in 2010 from heat waves. Respiratory effects are another health consequence that Dr. Damle elucidates here. respiratory effects from particulate matter and ozone result in exacerbation of asthma and other chronic lung conditions. He continues that 55% of the U.S. population test positive for allergens, and 34 million people have asthma. The increased length of the pollen season and growth of allergen-producing weeds, grasses, mold, and fungus will lead to more exacerbation of asthma and chronic lung conditions at an annual cost of $56 billion per year, with visits to the emergency room and hospital admissions. I was at a conference recently and saw a presentation by Dr. Carrie Nadeau, who's the director of the Sean Parker Center for Allergy and Asthma Research at Stanford University, and the Nadeau Foundation Professor of Medicine and Pediatrics. And I'm going to borrow a few of her slides that relate to the asthma and allergen concerns. Let me just start with this graph, which shows asthma prevalence nationwide and asthma prevalence in Rhode Island. In Rhode Island, we run a little bit higher for the experience of asthma than nationwide, and this is an issue that is important to us. It comes home to roost. Dr. Nadeau used this slide. This was exposure to extreme heat and precipitation events associated with increased risk of hospitalization for asthma. This was a study that was done in Maryland, USA, and as the temperature went up and there was extreme heat or precipitation, asthma hospitalization went up as well. If she showed a graph from another study in New York that related the ED visits, emergency department visits, related to ozone, related to smog, which is a well-known asthma trigger, and the estimated increase in ozone-related emergency department visits for children in New York from the 1990s to the 2020s resulting from climate change-related increase in ozone concentrations. So as the ozone concentrations went up went the ozone-related emergency department visits. The dark blue shows places where the emergency department visits went up 10%. The lighter blue, 7.8 to 9%. The even lighter blue, 6.6 to 7.7%. And in these counties, up 5 to 6.5%. Globally, we see that pollen counts go up in conjunction with increasing carbon dioxide. Back in 1900, there were about 280 parts per million of pollen production. 370 parts per million we hit in 2000. I take it back. At 280 parts per million of carbon dioxide, there was 5 grams per plant of pollen production. At 370 parts per million of carbon dioxide, pollen production increased to over 10 grams per plant. We're over 400 now, and we're headed for 720 parts per million, and at that point, we've more than quadrupled the pollen output. And we're seeing this happen not only in terms of the amount of pollen output that can trigger asthma, but also the length of the pollen season. So the months in which people who have asthma are vulnerable are extending themselves. Here, nearly 27 extra days. Here, 24 extra days, 17 extra days, 19 extra days, 14 extra days, 13 extra days. We went through the middle of the country here and saw over and over the ragweed pollen season is getting worse for asthma sufferers. Another thing that we've associated with climate change and with the drought spells has been wildfires. And wildfires, for obvious reasons, put a lot of stuff, ash and things up into the air. And in this monitoring map of California, when the wildfires were going on, you could see these spikes in asthma activity. So here's before the fire, here's during the fire activity, and here it falls back down afterwards. The risks for asthma climbed dramatically during that period. So wildfires present yet another climate-related risk for people who have asthma. And here's the wildfires in California shown to increase asthma as determined by the emergency department visits. And the emergency department visits climbed based on various risk factors. So when you're seeing folks having to go into the emergency department for asthma, that's gotten pretty serious. So there's a lot of support for Dr. Damle's assertion that this is a concern we should pay attention to. He goes on to list another category of concern: exposure to infectious disease from vectors such as mosquitoes and ticks. He says it has and will continue to escalate. There is a documented increase in cases of dengue, chikungunya, West Nile virus, and Zika. He goes on to say we will likely see a resurgence of malaria in certain areas of North America. Other illnesses come from other consequences of climate change. He goes on to report an increase in heavy downpours and flooding in America and the world will lead to an increase in waterborne diseases such as E. coli and other bacteria, salmonella, typhoid, and cholera, parasites like Giardia, and viruses like hepatitis A and Norwalk, with an impact, he warns, on millions of people around the world. He goes on to cite also extreme weather events which create stress, anxiety, and depression. Hurricane Katrina, he reports, led to 32% of people affected by the hurricane suffering from post-traumatic stress. So he concludes, we know that there will need to be a global effort to reduce anthropogenic greenhouse gas emissions, and the developing countries need to take a leading role in developing and implementing and monitoring the success of those mitigation measures. He goes on to conclude, we need to re-enter the Paris Agreement and move forward at the local and state levels for the benefit of our patients. He is a respected doctor in Rhode Island. He is a clinical assistant professor of medicine at the Warren Alpert Medical School of Brown University, and he was just recently the president of the American College of Physicians. Now, I know my colleagues don't want to listen to any of this stuff about climate change because the fossil fuel industry controls them so much that they cannot even say the words, in many cases, climate change, on the floor of the Senate. But for crying out loud, you've got the former president of the American College of Physicians talking about the health effects. You've got a prominent researcher at Stanford University talking about the health effects. You've got the National Weather Service warning about dangers and health effects from climate-related heat in the Southwest. When are we going to finally get around to having a serious discussion about this? So it's great that we've had a little pause on this wretched health care bill. I couldn't be happier to be rid of it for a while. I'm hoping we can be rid of it for good, but it's probably going to come back. We're going to have to hammer a few more stakes into the heart of this zombie before we're rid of it. And then we can get on to a serious bipartisan health care bill. There is good work to be done in health care. There is good work to be done on climate, but we've got to take the wretched special interest politics out so we can get to serious business. And with that, I yield the floor.